And good morning again. I'm Dr. Warner, ready to talk to you today for our webinar series of education for the sake of education. We're just going to talk about liver health today. Thanks for signing on. Hopefully your friends and family are signed on, or anybody you think might benefit from this. This is really liver health with a bit of a subtopic of how it would affect your orthopedic health or your musculoskeletal health. So go ahead and share the link to anybody you think might benefit from this. And we're going to be starting shortly. Okay. I'm Dr. Meredith Warner. I'm an orthopedic surgeon in Baton Rouge, part-time faculty for LSU Orthopedics in New Orleans, and also founder of the Well Theory, which is a line of natural health empowerment items such as supplements and pain creams, things like that, that let you take control of your own health. And also founder of the Healing Sole, which is a shoe I invented to treat foot pain and hopefully maximize foot health. But my true love is orthopedic surgery, obviously. This is my clinic in Baton Rouge. It's designed to promote health and wellness, and I work very closely with physical therapists. You can see our gym there, because I think physical medicine is a huge part of musculoskeletal health. Just popping pills probably isn't the best option. So today, I want to talk about liver health, and then why I care, why any orthopedic surgeon should care, and certainly why you should care about your liver. So, in theory, or at least my theory is, you can't successfully treat shoulder pain, neck pain, whatever, leg swelling, knee pain, foot and ankle deformity without getting the person optimized in terms of health. And you really need to understand the fundamental foundational source of any given presenting symptom, such as pain or stiffness, which is, of course, how everything presents, but those are just symptoms. So I try to back it up and get the actual true diagnosis, and not just looking at it in a sort of pure biomedical, oh, there's a little abnormality on the MRI, therefore I must fix that. That has been proven over and over again to be a false way to think about things. I know that your brain and your body and your spirit are all connected. And in addition, all of the cellular functions throughout your body dramatically affect how you feel physically in terms of your musculoskeletal system, one of which is the liver. And one of the main connections is insulin resistance. So as your liver loses the successful ability to process glucose and fats and things that you eat in the setting of excess nutrient intake, as the liver loses that ability, it gets sort of toxic inside of itself, inflamed, and there's a lot of oxidative stress, and then the function of the liver goes down, you become insulin resistant. We don't just get insulin resistant in the liver, obviously, but everywhere, starting in the brain, the adipose tissue, the muscle, the skeletal muscle, the gut, everything starts to fall apart with insulin resistance. So it's very important to keep a healthy liver, really just for that. But there's a variety of other ways the liver plays into bone and muscle and connective tissue health. So basically, a bad liver is a sign of bad health. And then you're basically going to have aches and pains everywhere, and your connective tissue is going to be fully dysfunctional. So making sure you have good liver health is really important to how you feel physically. So chronic liver disease is one of the most common reasons people die on this planet. So it's a common cause of global, what we call morbidity and mortality. Morbidity meaning problems, diseases, symptoms, mortality meaning death. Cirrhosis, you've probably heard of, that's sort of the end stage of any chronic liver disease. That's when your liver gets scarred, the tissue's distorted, and there's a complete failure of function. So not only are you not able to process the metabolic load you give your body, in other words, the nutrients that you get, because there's a direct connection of blood from the gut to the liver. Not only can you not process food, but you also can't process toxins and drugs correctly, and things just kind of just go haywire. So multi-system failure is one of the problems with chronic liver disease. Musculoskeletal, hormonal, cardiac, nervous system, everything just begins to fall apart because you don't have this central processing factory that's manufacturing normal metabolic byproducts and also acting as your detoxification plant. So when you lose those capabilities, you're almost like a city that has no electrical grid, nor has trash and water service. So obviously there will be total chaos. So one of the ways the liver affects bone health is when you have this condition called hepatic, which is the Latin derivation that means liver. So anytime you hear hepatocyte, hepatic, HEP kind of denotes liver. So hepatic osteodystrophy, meaning bone badness, okay? In this condition, because of the chronic liver disease and the fact that the liver cells aren't behaving normally and not producing proper proteins and whatnot, you get osteoporosis, osteopenia, osteomalacia. So those osteomalacia means bad bone or dysfunctional bone. Osteopenia is slightly demineralized bone. And then osteoporosis is very brittle, thin, completely demineralized bone that has no ability to repair itself very well. And this is because of the very low bone mineral density that's found with NASH and NAFLD. NAFLD, of course, being non-alcoholic fatty liver disease, and NASH is non-alcoholic steatohepatitis. Again, hepatitis, inflamed liver, and then steato is like filled with fat. So this is when you start to get the scarring and the real damage to the liver physically. NAFLD is when it's just packed with fat, and it makes the insulin resistance and the inflammation levels go up. So if you have NASH and or NAFLD, your incidence of septic arthritis when you have hepatic osteodystrophy is higher by about 1.5 to 2-fold for anybody else, meaning you're at a very high risk of getting infected joints. And so you have higher infection susceptibility. You also have more sarcopenia, meaning you have less skeletal muscle. And we've talked about that before, how important it is to keep your muscle strength as you get older, because it diminishes the risk of what we call frailty. And then people with hepatic osteodystrophy also have a higher risk of what's called osteonecrosis, which is dead bone. So osteobone, necrosis, dead. So dead bone of the femoral head. So these are people that randomly have their hips just start to hurt. The femoral head dies off because of dead bone, because of AVN, avascular necrosis or osteonecrosis. And then they have a higher risk of needing a total hip replacement by 10-fold. All because of hepatic osteodystrophy, just because the liver is not functioning properly. And we'll get into why in a bit. And then, of course, if you do get a total hip, you're at higher risk of periprosthetic complications such as fracture, infection, loosening. And then, of course, anybody with NAFLD or NASH is at a very high risk of osteoporotic fractures. So not only do you have a bum liver, but you're at a higher risk fracture risk in general because your bones aren't functioning properly. So that's one of the ways liver health affects you in terms of orthopedics. So what about pain? Well, pain is a complex situation, if you will, but one of the things that's been associated with chronic pain is low vitamin D3 levels in people. And D3, we all think about the skin and sunlight being important. However, in order to convert to the active form that your bones and all of the tissues in your body can use, because remember, or maybe you don't remember, but almost every cell in the body has a vitamin D receptor. Just like thyroid receptors are all over the place, so are vitamin D3 receptors. But they only respond to the active form of the vitamin, and you need a healthy liver and a healthy kidney to get there. So there's a certain number of steps that take vitamin D, which is a cholesterol molecule, and the liver is very important in manufacturing fats and cholesterol. So vitamin D3 has to be converted through different hydroxylases or enzymatic reactions to get to the active form. And so the liver, which is involved in cholesterol synthesis and also involved heavily in protein synthesis for like enzymes, if that goes down on top of hepatic osteodystrophy, then you have less vitamin D3. And then what that means is you're more susceptible to joint pain and joint problems. So one thing I see in my clinic a lot, people with vague knee pain or joint pain after they've started working out or whatever, you get an MRI and you see all of this signal in the bone, but there's no true fracture line, but it's just bright, meaning there's a lot of fluid in the bone. What we found is that that is highly associated with low vitamin D3 levels. So if I see that on MRI, I automatically check their vitamin D. Because if you supplement with vitamin D3 in that setting, you can get rid of that soft tissue intolerance and that subchondral stress or that stress in the bone that causes the signal change on MRI. So we see this all the time in orthopedics. So not only do you have changes in steroid metabolism, which steroid is, part of that whole cholesterol pathway, you also have changes in the activation of the D3, and then, of course, the hepatic osteodystrophy we already talked about. And then there's some medications that people take when they have liver problems that further make the problem worse. Proton pump inhibitors are highly associated with osteoporosis and stress fractures. Exogenous steroids that people take, like estrogens and testosterones, and then diuretics that people take. And a lot of the diuretics have you urinate out minerals that further deplete your bone and tissue health. So that's one way liver affects orthopedic situation. The other way is higher levels of inflammation. And again, if you watch my webinars, you know, I think and I believe, based on everything I've read and learned, almost all orthopedic problems come down to oxidative stress and chronic inflammation, just like every other chronic non-communicable disease in the world. So in the setting of chronic liver disease, NAFLD NASH, you have higher levels of inflammatory proteins, otherwise known as cytokines, such as IL-1, IL-6, and tumor necrosis factor alpha. Now, IL-6 and tumor necrosis factor alpha, they may ring a bell if you watch my autoimmune talk. They're always upregulated in conditions like rheumatoid or lupus, things like that. So just having a bad dysfunctional liver can upregulate these cytokines with or without an autoimmune disease. And when you have these pro-inflammatory proteins running around your body, like TNF alpha, then you upregulate the bone chewing cells, the osteoclasts. So your bone is constantly being maintained and remodeled. And there's a balance normally between osteoclasts that chew up damaged bone or dysfunctional bone and osteoblasts that replace it with better bone. And then osteoclastic activity is brought about by this substance called RANK-L, which is receptor activator for nuclear kappa factor ligand. Basically, this is a receptor that, when triggered, increases levels of NFKB, which is a gene that upregulates inflammation. And it also turns on the osteoclasts, or the bone chewing cells. So not only do you get hepatic osteodystrophy, lower levels of active vitamin D3, problems with the medications, but now we've got more inflammation just because of the fat that's been packed all through the liver in the setting of insulin resistance and an unhealthy liver. Okay, so just quickly, 75% of people with chronic liver disease have osteoporosis. So that's pretty bad. And then, as we discussed previously, NAFLD, or non-alcoholic fatty liver disease, which an abundant amount of Americans have this, by the way, increases your fracture risk. You and I have about 1 million what are called bone remodeling units, which is your osteoblast, osteoclast coupled activity. And osteoporosis is just a complete decoupling, and the osteoclasts get hyper, and the osteoblasts like go into hibernation. So you got a 1 million bone resorbing or bone remodeling units, and liver health will change the balance, either pro or anti bone health, mostly anti. So you have more activity of the osteoclasts or the bone destroying cells and much less activity of the bone building cells. And one of the other reasons this happens is, again, back to insulin resistance and inability to create needed proteins. You have lower levels of what's called IGF-1, which is insulin-like growth factor 1. Very, very important to the building and repairing of your system. So lower IGF-1 levels mean fewer osteoblasts, which changes the balance of those 1 million bone remodeling units in your body to your detriment. So because the osteoblasts are effectively damaged because of the bad liver health, you're going to, and this is because of the lower IGF-1 levels and also higher bilirubin levels, and we're going to talk about bilirubin in a minute. You have higher levels of what's called sclerostin in the body, and this is very prevalent in people with cirrhosis. So remember, cirrhosis is end stage. So that's not as many people, but it's all a continuum. So most people with NAFLD are on that path. So you're going to have slightly higher levels of sclerostin. Sclerostin is a signaling protein, and it basically is secreted by bone-forming cells, and it prevents stem cells from becoming osteoblasts, or the bone-creating cells. So remember, you got the osteoclasts, the osteoblasts, and then you have the osteocytes. Osteocytes are the cells that live in the bone that maintain the bone, and then the osteoblasts build the bone, the osteoclasts take away damaged bone. Sclerostin kind of can change that balance for you, and in the setting of cirrhosis or NAFLD or late NAFLD, you have higher levels of that, which means fewer osteoblasts. So all of this is going to just combine all of these effects to make your bone weaker, which means the joints are weaker. You have more propensity to get those stress reactions that I told you about that we see on MRI, and more episodes of pain, fracture, joint collapse, osteophyte formation, things like that. All right, this is a busy slide. I'm just going to blow through it for you really quickly. So remember, the liver is important in steroid metabolism, cholesterol metabolism, one of those being growth hormone. And so lower levels of growth hormone, and IGF-1, which is linked heavily to growth hormones. So when I run panels for this, I'll look at not just growth hormone, but also levels of IGF-1 for people. And IGF-1 is a really good proxy for how healthy your growth hormone system is. People with low levels of growth hormone will have lower levels of IGF-1. Now, you don't want to have too much IGF-1, but you also don't want too little bit of it. And that's because of this is one of the reasons. But fewer osteoblasts are made, which means your bone health is poor. And I don't know if you remember from one of my other talks when we talked about exercise, but bone health is super important for brain health. And we're going to get into why briefly later. Parathyroid hormone you may have heard of. This is key to bone health, and it regulates your calcium balance in your serum. And if you remember, calcium is very, very important for how your nervous system functions and for communication between cells. And it's also obviously important for bone health. So parathyroid hormone sort of regulates that by sensing how much calcium is running around, and it will actually influence the bone, the kidney, and then indirectly the liver through this RANK-L system, okay? And remember, RANK-L, that ligand that upregulates the gene that causes pro-inflammation, is associated with inflammation, and this is upregulated with bad liver health, and it's part of the tumor necrosis factor alpha superfamily. So RANK-L is very heavily pro-inflammatory. So we don't want a lot of that running around. One of the reasons you want to keep a little bit or no fat packed around your liver is because you want to reduce levels of inflammation and production of these inflammatory cytokines. And so RANK-L is secreted by osteoblasts to stimulate the osteoclast. Remember, they're supposed to be coupled. So they're supposed to be communicating with each other and turning each other on and off as needed by the skeletal system. But if you've got a heavy amount of inflammation because the liver's insulin resistant and packed with fat, then you're going to have an altered balance because there's going to be more RANK-L and more inflammation. And that's another way the liver health affects you. Yeah, if you have questions, just feel free to ask. I know this is a lot of information. So remember I told you the liver is important in steroid production, cholesterol production. Well, if you have bad liver health, then you also can have what's called hypogonadism, which means you're going to have fewer of the steroid molecules running around. So weaker estrogens and a lack of testosterone or diminished testosterone. And of course, this also results in higher levels of bone turnover, weaker bone, but also sarcopenia, meaning weaker muscle and lower amounts of muscle. And then really the connective tissue itself becomes dysfunctional. Another way poor liver health really dramatically affects the MSK system is if you have a poor gut biome. And this can happen with what's called leaky gut, which is maybe not the greatest term. Some people argue about that. But effectively, your gut is supposed to have a very tight barrier between each cell. And in leaky gut, that opens up and it lets toxins from bad bacteria go into the portal vein system or the blood flow that goes directly to the liver. And of course, that's going to cause inflammation and problems and scarring in the liver itself. And it sort of becomes a back and forth thing. So bad liver equals leaky gut equals bad liver, back and back and back. And then what happens is you have fewer short chain fatty acids, which are normally created in the colon when you have bacteria that digest fiber that you can't digest. The bacteria eats up the insoluble fiber, creates short chain fatty acids, which then go on to help the rest of your health, to include brain, nervous system, musculoskeletal, etc. So the short chain fatty acids are extremely important for your overall health. And if you don't have a proper gut biome, you're not making them, you're getting a leaky gut, the intestinal barrier opens up, and then inflammation and toxins go straight to the liver. And again, the gut biome will actually alter your levels of IGF-1. So we're right back to less of the building blocks to make your system work better. So more cytokines that stimulate osteoclasts, back to the osteoclasts, the bone chewing cells, happen if you have a leaky gut. So all of this is working together against you, and it's really all coming down to inflammation in the liver, mostly from excessive levels of nutrition. Okay, and we talked about the avascular necrosis, and one of the ways this happens is not just inflammation, obviously, but you have to have something that diminishes blood supply to the bone. And we're still working out exactly what's happening here, But effectively, when your liver isn't making proteins properly and it's not functioning properly, then you're not going to have all the blood clotting factors that you need. And you get what's called a coagulopathy, or your blood flow is altered in a way that you're going to clot off the microvessels in the bone, and you can cause dead bone that way. There's going to be more inflammation, obviously, and you're going to have bad BRUs, or bone remodeling units. All of that is going to conspire to create little pockets of dead bone in high stress areas like the femoral head. So what can you do about it? Well, let's talk about the circadian clock really quickly. Circadian medicine, I just want you to kind of keep this in the back of your mind, really at all times for everything. But liver health is heavily dependent on circadian rhythm, just like everything else, your brain health and whatnot. The liver's a little bit different because it gets triggered by nutrition sensing. So that is its Zeitgeber. Zeitgeber is a German word meaning like signal. So your clock, your circadian rhythm, is entrained or trained by various signals: light, dark, eating, not eating, things like that. So getting up, moving, cortisol, melatonin, all of these things are signals that get your cells coordinated, where they have certain functions that are dependent on the time of day. So obviously your cells can't do everything all the time, and certain things should happen at night and certain things should happen during the day. So you really need to match your liver's clock to your brain's clock, so the feeding clock to the light dark clock. Normally, we want to be synchronized over 24 hours. So in other words, optimal entrainment, we call it. So you want the sleep wake cycle to match the feed fast cycle, ideally. And then after just 10 days or less of dysregulating that, you can develop prediabetes, because you develop insulin resistance because nothing is working right, because you lack this coordination between what the brain and the hypothalamus is wanting you to do and what you're doing in terms of disrupting the cellular clock. So in other words, your cartilage should repair at night when you're asleep and fasted. If you mess that up with a midnight snack, then your cartilage doesn't get repaired properly. So you've dysregulated it. Same thing with the liver, same thing with your insulin receptors. So you can actually develop altered glucose metabolism because your cortisol wave is not working right, and cortisol directly affects glucose. And also you develop insulin resistance if your circadian rhythm doesn't match the gut rhythm. Okay. So your liver influences what are called peripheral clock genes, meaning clock is just an abbreviation for the genes that are in all of the peripheral cells in your body that have to be coordinated over a 24-hour period. And then the liver will send signals to the peripheral clock genes to turn them on or off, just like your brain will. The brain is triggered by light, the liver is triggered by food. So you really need to match when you eat to when you're awake and asleep, and it should not be all over the place. Okay, so metabolic disorders result from sleep deprivation. We just said that. 10 days of a dysregulated circadian rhythm, and you could develop prediabetes. And food will train your liver's clock. The liver clock will oscillate even when you don't have oscillation of other clocks. And the liver clock controls your NAD production, which NAD is one of the mandatory shuttles of electrons in your mitochondria, and it's a so-called anti-aging molecule. If you don't have proper levels of NAD, everything just sort of falls apart. You feel very fatigued. The mitochondria doesn't function well, and you have more DNA damage because you have less capacity to repair damaged DNA. And the liver clock will control this and how you use glycogen. And I don't know if you remember from our talks before, but food will be converted into usable molecules, one of which is glucose, of course. But if you don't need glucose, it gets stored. Normally, the first storage depot is going to be glycogen, which can be found in your muscle and in your liver. And then the second storage depot is going to be fat or adipose tissue. But the liver controls all of this, and it works best in concert with a good light-dark cycle and a good feeding fasting cycle. So it's important to manage this as best you can and try to coordinate sleep to match eating. In other words, you don't want to be having midnight snacks. You don't want to eat the first thing when you get out of bed in the morning. You want to stay fasted for about an hour or so. Things like that dramatically affect your health and your liver health, which ultimately affects your musculoskeletal health. So again, a lot of processes in your body are heavily dependent on timing. I mean, think about anything else in your life. You know, my office is cleaned at night. So the cleaning and the repair systems happen in my office at night when all of the other functions of our office are shut down and turned off. Same thing happens in your body. You're pounding your cartilage and your connective tissue all day. You're doing stuff, you're moving around, you're lifting things, you're living life. Well, inevitably, something's going to go wrong at a cellular level. So at night, your system is all set up to repair that. But if your cycles aren't matched, your oscillations on a daily basis, you're not repairing anything and you're just going to deteriorate and fall apart. So you want to align your organ functions to your cycle with your nutrient supply and demand. So feeding late when you should be starting to be fasted and close to the sleep time really messes things up, and you're not repairing anything at night. And you're in a constant state of what we call social jet lag, which you're not supposed to be in a jet lag state. Again, everything should match all the time. But when you're in this constant state, you're just basically creating aging in your body because you're not allowing any maintenance functions to occur, to include the liver and or musculoskeletal system. And then, of course, you're going to end up with prediabetes, then diabetes, insulin resistance, metabolic dysfunction, et cetera, et cetera. So one of the simplest things you can do to improve your liver health is get on a good schedule. And then this is just more about the zeitgebers, or the signals that turn on or off the genes all throughout your body, and the muscle and the nerves and the connective tissue and the brain, in the cardiac system, in the intestinal system. And then the enzymes and genes that control all of these functions, either the active functions like that let the muscle move, or the repair functions that repair the muscle and allow you to build protein to make your muscle stronger. All that has to be coordinated. And then that also is inclusive of the pain system as well. So people that don't have a good circadian rhythm that matches a good liver circadian rhythm end up in more pain, more dysfunction, stiffer, having more problems. So this is one of the simplest things you can do to improve your liver health, is just put it on a schedule. The liver is in charge of carbohydrate metabolism, lipid metabolism, amino acid or protein metabolism. It detoxifies everything. It makes proteins for you, to include the coagulations ones we talked about. It's also in charge of bile acid production and maintenance. And that's, bile goes through your gut to help capture fats and stuff. So you want to keep on a constant, what I call a constant routine protocol, if you want to diminish inflammation and insulin resistance. So you will make less of what's called CRP, which is now a new biomarker, both for cardiac health and overall inflammatory state. CRP is a biomarker that's created by the liver in the settings of increased inflammation. So if you want to have low levels of CRP, you need to be on a constant routine of sleep, wake, feed, fast. All right. So the early evening, you're supposed to have the peak expression of your glucose transporters to pull glucose out of the blood, because it's sleep is when you do your most fatty acid oxidation, believe it or not. So when you're asleep, you're really burning fat, okay? You're not really burning glucose. The glucose is reserved for the brain. And then there's more of a glucagon receptor that happens at night. And then there's more metabolism of sugars really by the brain during the fasted state. But in the early evening, you're prepping for all that. Also under circadian control is your triglyceride creation and accumulation and packing into fat. Your HMG-CoA reductase system, which is heavily involved in cholesterol synthesis, so HDL, LDL, VLDL, all of that is on a clock too. And it's most active, this cholesterol biosynthesis molecule is most active when there's not supposed to be nutrition, so it's in the fasted state. So you don't want to mess that up too. And that is the enzyme that is downregulated by statins, by the way. And then the liver is also the main production site of your active thyroid hormone. And you have oscillations of the enzyme that convert inactive T4 into active T3. So if you have thyroid issues, maintaining liver health with a constant routine and a normal feeding fasting cycle every day is going to be super important as well. And again, if you remember from the beginning of the talk, not only are there D3 receptors everywhere, but there's thyroid receptors everywhere. So you really want to keep your D3 levels good and your thyroid levels good. And then also under oscillation or 24-hour clock, scheduling control is how your immune system functions. And the liver is very important here too. Again, the rhythm matters greatly. So not only is the liver producing many of the proteins of the innate immune system to help fight infection is the first thing everybody thinks of, but the other thing the immune system is important in is fixing problems in your body. So broken cells, broken cell membranes, oxidized cell membranes, things like that. Any sort of breakdown in your system, somebody's got to come in, clean it out, prep it for repair, and then repair it. And that's your immune system. That's under the control of the liver, which is under control of the oscillations of the daily clock. Same thing with the coagulation system that we already talked about a few times when we talked about the common occurrence of avascular necrosis in people with liver failure. So, how does this play in orthopedics? Your musculoskeletal system is heavily dependent on good glucose control. Insulin resistance is the enemy of your musculoskeletal system. Again, a good circadian clock or a good circadian rhythm, wake up at the same time every day, go to sleep at the same time every day, try to match where you eat and don't eat to that. Have nocturnal starvation. So in other words, be fasted at night, because that's when you're going to have the upregulated enzymes and proteins that allow for repair of muscle, repair of bone, repair of ligaments, repair of tendons, repair of cartilage. Your insulin and your glucagon secretion are also rhythmically controlled. And then again, unless you have an aberrant zycobur or a bad signal like that midnight snack, that's going to screw everything up. And then the pancreatic clock, each cell in the pancreas is under oscillations or a 24-hour clock control. And what is a pancreas important for? That's where your insulin is produced and spit out. So all of this is very, very important. And the whole point of all of this is to maintain the same level of glucose, or at least a tight range in your body. Why? Because your brain loves glucose. So the body really tries to keep your pH, or the acidity of your system, in a very tight range. All of your electrolytes like sodium and chloride and whatnot in a very tight range, and your glucose in a tight range. Because once those ranges are exceeded, either to the upside or the downside, everything falls apart. So your body's going to do everything it can for those three things to try to keep those super, super tight. And then when you get insulin resistant, it makes it really hard for your body to keep those glucose levels super tight. And that's when you have problems. So again, the liver is very important in terms of metabolism of proteins, also carbohydrate and lipids. So nutritional proteins, you want to break them down to the amino acids, which are then used for things like making muscle. So if you're not processing proteins in the liver properly, you're really going to be at higher risk of sarcopenia. And we see that in people with chronic liver disease. We also see it in people with NAFLD, which is, again, very common in this country, independent of whether or not they're technically obese or insulin resistant. So you can start packing fat in your liver well before you would show up on blood work to be insulin resistant. And again, there's a very strong interaction between sarcopenia and osteoporosis. And then if you're osteoporotic and sarcopenic, there's a higher risk of being demented and having cognitive breakdown. All of this is linked, and it comes down to good liver health and trying to avoid insulin resistance if at all possible. All right, so just to kind of give you a clinical picture, there's a very strong correlation between diabetes mellitus and osteoarthritis. So they move in lockstep together. They have the same risk factors for disease, the same environmental factors, and the same genetic factors, more or similar genetic factors. Both are non-communicable chronic diseases. Okay, these are diseases you can't catch, but they're chronic and they're highly prevalent, particularly in our country. And they are both signs of metabolic dysfunction. And something like 90% of Americans have metabolic dysfunction. That means only 1 in 10 people in this country are metabolically healthy, which is very scary because that puts us all at risk of osteoarthritis and diabetes, both of which can really dramatically destroy your quality of life. So the molecular and the cellular level disturbances that we see in arthritis and arthritic type conditions are heavily linked to insulin resistance, just like diabetes is. So again, you want to keep your liver healthy. You want to be able to process all of your nutrition in a proper manner, and you don't want to get insulin resistant. 50% of adults that have arthritis report that they are limited in the work capacity and daily activities. What are daily activities? Washing the dishes, cleaning the house, taking care of kids, cooking, cleaning. So if you're one of them, you know what I'm talking about. We're just doing the basic functions of keeping your house in order become very, very difficult with osteoarthritis and with connective tissue disorders. And the risk of arthritis if you have diabetes is 1.4 or 1.5 fold. So the prevalence is 30%, meaning of diabetics, at least 30% of them have arthritis. And then those that are arthritic, about 14-15% of them have diabetes. So these things are very, very tightly linked, and the link is insulin resistance. So type 2 diabetes mellitus has been shown to be an independent risk factor for needing a total knee in your life. Think about that. You would think, what does diabetes have to do with the total knee arthroplasty? Well, now you know why. They're tightly linked through insulin resistance and the inability of cartilage, bone, and connective tissue to repair itself because of the altered liver function and altered circadian rhythm, and then the insulin resistance on top of that. So they're just different manifestations of the same foundational problem. So the insulin resistance, what does that mean? That means that you have lost the ability of the receptor for insulin to work properly. So every cell is surrounded in what's called a membrane. Think of it like a water balloon, and there are different little locks all through the water balloon, and different keys come in and open the locks. So the lock is a receptor, the key is a ligand or a protein that links to it. So insulin is one of the keys, the insulin receptor is a lock. Insulin normally attaches to its receptor and creates this whole host of changes inside of the cell that promotes repair, building. Insulin is like your build hormone. So you have insulin when you're in an abundant energy state, and you diminish insulin when you're in a starvation state, because you obviously need to reserve fuel for the brain. If you're in a starvation state, you can't be building protein, building muscle, creating IGF-1, depositing fat. All of that's on the insulin team. The problem we have is we have too much nutrition all the time now. People are eating too much. There's way too much nutrient intake. And so you're constantly pumping out insulin to try to pack this stuff away and store it, because you don't need it all the time, and you're just building, and eventually everything falls apart. The first thing that happens is the receptors get tired of linking to this insulin ligand all the time, and they just start to break and shut down. Now, we're not getting into the mechanisms of insulin receptor insensitivity. It has to do with different phosphorylations of different types of proteins that are associated with the receptor. And it all comes down to inflammation and oxidative stress. But the fundamental problem is too much nutrition floating around, and these receptors are just pounded with excessive amounts of insulin until the pancreas can't make it anymore. When the pancreas becomes insulin resistant and can't produce the insulin anymore, that's when you have to start taking insulin as a diabetic. And of course, some people have autoimmune disorders or genetic disorders where their pancreas isn't going to make insulin to begin with. Those are your type 1 diabetics. But most of the problem in our country is going to be type 2, which is from constant insulin resistance. Now, insulin receptors are also found in connective tissue in the musculoskeletal system. And as those become insulin resistant, again, the cartilage doesn't behave well, it doesn't repair itself, it doesn't survive as well, it deteriorates. Same thing with the synovial lining of your joints, same thing with your tendon cells, the tendon sheath, the ligaments, the bones, the muscle. All of these things start to lose their normal function in the setting of insulin resistance.
Do they still do that if you're taking insulin? Some people think this was.
Oh, the question is, we had a question. If you take insulin, does that solve the problem? In other words, if you are on an insulin medicine, or you're on a medicine that increases the pancreas production of insulin, does it solve the problem? No, because the problem is not the insulin, it's the resistance to the insulin. So the reason people take insulin is because they have to overload their system with as much insulin as possible to try to find the couple of receptors that are still working, because the pancreas has been blown up from years of nutrient excess intake. So just taking insulin does not solve the problem. You have to get to the point where the insulin receptors become more sensitive, and that solves the problem.
My problem is that I can't get all of the nutrients my body needs in such a tight eating window. If I'm to go to sleep fasted, all the protein, the vitamins, minerals, any of those foods, grains, vegetables. What are your thoughts on that? What do you recommend as a solution? I guess they're feeling like they can't.
Okay, this is an individual that just asked a question saying they feel that they cannot get all of the nutrition that they need in a tight eating schedule. I'm not sure what schedule they're on, but there's plenty of studies that show that people are able to get the nutrition they need in even a schedule as tight as 6 hours a day. So I'm not sure what this particular person thinks that they need, but most people can achieve it. I mean, in just something as simple as a 12-12 schedule is better than nothing. Most Americans eat for 15 or 16 hours a day. If you could compress that to just 8 to 8, you're doing a lot better. Studies have shown that 10 hours of eating versus 14 hours of fasting is a really good schedule, probably as good as the 8 hours of eating schedule with, 16 hours of fasting. So you should be able to get the amount of nutrition you need in that compressed time frame. Now, one way you can fix, like if you can't get enough fruits and vegetables because of work and life, that's when you supplement, which is what I do. Because yeah, I get too busy to eat 9 servings of fruits and vegetables in a 10-hour eating schedule, which is what I do. So I'll just supplement with antioxidants and anti-inflammatories and fiber and things like that. But it is possible. You may just need to get with someone. If you don't have access to me, like if you're in a different state, find somebody that understands this, who can work with you and maybe help you plan your meals better.
I think she's saying because it doesn't digest all that.
Yeah, digestion, I mean, to clear your gut, it's about 5 hours. I think one thing that happens when I talk about this stuff and when people think about this stuff, the time restricted eating and trying to match your gut circadian rhythm to your sun dark circadian rhythm, I think people get very stressed out about doing it perfectly. I think compressing your eating schedule a little bit to sort of match a sleep-wake cycle and to try to keep a better sleep-wake cycle every day, anything you do is going to be very, very helpful to the normal American lifestyle. So I don't think you need to necessarily stress out about this stuff, because stress is going to increase your cortisol levels, which is going to blow the whole thing anyway. Mental stress is one of the primary reasons we fall apart. So I think just do as good as you can, and then maybe in a few months after you get really good at whatever it is you're doing now, you incrementally improve it a little bit then. But to try to achieve perfection, I think is sort of a false aspiration that really just makes us all stressed out. That's my opinion. Right. Cutting out processed food is rule number 1, as much as you can. So again, osteoarthritis and insulin resistance. So if you have insulin resistance, you have a diminished capacity to pull glucose out of the blood and store it properly where it should be, in either glycogen or adipose, if you don't need it right then and there to, as fuel. So when you have too much sugar floating around in the blood, the sugar molecules will bind to amino acids themselves without the need of an enzyme. This just happens. And then you get what's called an advanced glycation end product. So when diabetics, or when you go to the primary care and they check your HbA1c and they say, oh, you want it to be 5.5 or less, what they're looking at is the glycation of the red blood cells. So the proteins on the red blood cell that get glycated based on your average blood glucose level over the prior 3 months, because the half-life of a red blood cell is 3 months. So the HbA1c you're familiar with, and that is an indirect measure of glycation that's happening throughout your body. One of the problems with elevated serum glucose is you're not just glycating red blood cells, which of course are made and die, and they're recycled, and they get recycled into bilirubin, by the way. But these monster proteins, these advanced glycation end products, they love long-lived proteins, which means what? Tendons, ligaments, fascia, connective tissue, the fascia around all of your nerve cells, cartilage, bone, and all of the intrafascicular connective tissue and muscle. So you get these monster proteins that are causing stiffness, pain, and joint dysfunction, and they diminish the ability of your joints to repair themselves at night. And that happens with too much blood glucose, which happens with insulin resistance. So we're all forming ages all the time. It's inevitable. It's part of life. It is what makes us quote unquote age, but you can change the rate of it. Diabetes is often called advanced aging because of this, because you form these advanced glycation end products at a much more rapid rate, and you get stiffer faster. The nerves become dysfunctional and thus neuropathy faster. The skin gets damaged faster, and you're unable to repair and self-heal, which is the body's real superpower. Okay, so again, everything is coming back down to insulin resistance, right? Which the liver is clearly fundamental in that. You have poor mitochondrial function throughout the body, to include the connective tissues. And connective tissues are pretty much everything that you think of as musculoskeletal. So you get these advanced glycation end products. They deposit in these long-lived proteins, which is why your joints feel stiff, why you're having pain, why the cartilage is feeling not right. You have higher levels of inflammation when you have these deposits, and you have more oxidative stress. On top of that, the chondrocytes, the bone cells, the ligament cells, the tendon cells, and muscle cells have poor insulin receptor activity, so they're insulin resistant. And then you are unable to create the proper synthesis of the repair molecules that you need to fix the cartilage at night, and you're unable to do any of the repair functions in general. So every day you're deteriorating, but you're never fixing the deterioration. Every day you're chewing up bone, but you're never depositing new bone. So this is just this big, huge self-feeding cycle that starts to get worse and worse, because with more damaged tissue, of course, you're going to have more inflammatory signals, more inflammatory cytokines, more oxidative stress because of more free radicals, because your mitochondria is not functioning properly. So as you can see, this is a big, huge circle, and the primary way to control it all is to get your liver healthy, with more fiber, better gut health, better gut biome health, but also to control insulin resistance, which means you have to control the nutrition that you're giving to the system on a daily basis. So if you're insulin resistant, you're going to be more prone to cartilage deterioration. I already showed you the numbers of osteoarthritis with diabetes. But remember, insulin resistance happens before full-blown diabetes. Full-blown diabetes is when your pancreas can't really spit out enough insulin to keep up with the bad receptors. 50% of Americans, we think, are insulin resistant right now. So insulin resistance really starts in the muscle, the skeletal muscle, the liver, and then goes to the adipose. Now, some people think that the real fundamental start is in the hypothalamus in the brain because of heightened inflammation in the brain. And then the hypothalamus controls your hunger and satiety signals. When the hypothalamus is dysfunctional, you start to eat too much, et cetera, et cetera. There's a variety of theories right now, but basically, you will become insulin resistant in your skeletal muscle, your hypothalamus, your liver, and then the fat cells. The liver, again, is responsible, remember, for keeping that tight range of glucose so that your brain is always happy. If the liver starts to become insulin resistant, it starts to lose that ability. So your glucose starts to go all over the place, your brain's not happy, nothing's happy. And then insulin resistance also alters the formation of the proteins that we've been talking about that we need for coagulopathy, for different enzymes that are involved in metabolic functions, et cetera, et cetera. And then also the detoxification capacity of the liver becomes diminished because all of the proteins that are involved in managing toxins and getting them ready to excrete either in urine or in feces, that goes downhill. So you become more toxic. So normally, your glucose levels are going to be managed by high secretion of insulin. And I don't know about you guys, but normally when you go see a doctor, they're not checking your fasting insulin levels. They're only checking your fasting glucose. Well, all the fasting glucose level is going to show you is if you're spitting out enough insulin to make up for the insulin resistance that you probably have. So a better test might be your fasting insulin in addition to your fasting glucose. Because if you're higher than, I think it's 2.4 millimolars, then you're starting to be insulin resistant. So you could have like a glucose of 80 or 90 and look perfect, but your insulin could be like 5 or 6, which means you're insulin resistant. So it's kind of a trick. I don't want you guys to go out there and just rely on your glucose levels. I would ask for fasting insulin. And then we're going to talk about some other tests that would tell you if your liver is functioning well. So again, the pancreas is just spitting out more and more insulin, and then you end up with more and more glucose oscillations, I guess. So your liver is unable to maintain a tight level. You get more of these advanced glycation end products. They deposit in your connective tissue. You start having more joint problems, muscle problems, tendon, ligament, et cetera. And then you have, of course, heightened chronic low-grade inflammation. You deposit more fuel in the fat cells. They start producing more of these cytokines. And again, another self-feeding cycle of inflammation from these altered glucose levels. So insulin resistance syndrome, metabolic syndrome X, you may have heard of these terms. These are all precursors to full-blown diabetes. Insulin resistance syndrome, we think, starts up to 2 decades before your fasting glucose level in your blood work is going to show it. So think about that. So we think about 50% of Americans are insulin resistant, right now, even though they have normal fasting blood glucoses, and 90% of us are metabolically dysfunctional. So either your waist circumference is too big, your LDLs are out of whack, your triglycerides are out of whack, there's your blood pressure is too high, different things like that that are signals of metabolic dysfunction. 90% of us have this. And then when you check your fasting insulin, if you're arthritic, 82% of the people that have arthritis and other musculoskeletal problems are going to have a high fasting insulin level. Why? Because they're insulin resistant. That's why their joints are falling apart. So this is all tightly linked. You got to give your liver the proper levels of nutrition and keep it from getting scarred and keep fat from getting packed in it. Okay, you got to keep your gut healthy, you got to keep your liver healthy, or you're going to get problems like arthritis. And then along with arthritis, that's when we see higher levels of diabetes, cancer, dementia, high blood pressure, cardiac disease, heart attacks, atherosclerosis, all of that. And this is all related to higher fasting insulin levels because of insulin resistance. This is just to show you the complexity involved in the energy cycle and then the management that is needed. So you really don't want to mess with this, okay? This is a very, very amazing design that's able to fix almost any problem unless you tip it too far one way, which is what we're doing in this country with ultra-processed foods and way too much of it all the time. Sugar, yeah. Added sugar and fructose, which is really way worse than sugar, honestly, if not attached to a significant amount of fiber. So we get insulin resistant from what is called technically overnutrition, which means you're eating too much, probably. And then there's increased oxidation of free fatty acids, and then higher levels of different breakdown products of the glucose cycle that then go on to become free fatty acids. You're inhibiting the enzyme production that allow the normal processing of glucose and other nutrition. Everything is just getting messed up. You're getting more hyperglycemic, so you have more advanced glycation end products. And then you're getting stiffer tissues, dysfunctional cartilage. You can't repair it at night. Your pain levels go up. Your vitamin D3's gone down. We already talked about that. Your bone is weaker. We talked about that. And you have no repair and healing capacity. So now you've got higher triglycerides running around because you can't deposit the fuel, the excess nutrition. So the overnutrition has to be put somewhere. When you run out of adipose cells, when they can't get any bigger and there can't be any more, that's when the adipose starts to spit it all back out and it gets packed in the muscle, it gets packed in the liver, anywhere that it can be. You get the visceral fat that everybody talks about, which is why one of the biggest and best markers for health is your waist circumference. I think men, it should be less than 40 inches at the belly button, and women, it should be less than 35. So if you are higher than that, that means you're depositing visceral fat, which means you're insulin resistant, most likely, okay? And then, of course, all of this is going to promote things like osteoarthrosis. You're going to have hyper levels of leptin, which is also damaging in and of itself. Leptin being the satiety hormone that normally would make you stop eating, but we become leptin resistant in overnutrition, just like we're insulin resistant. So you lose that signal that tells you to stop eating because your hypothalamus is also insulin resistant and is overinflamed. We have a question.
So will IF reverse the damage?
Will IF reverse the damage? So I think they're talking about maybe IGF, or are they talking about intermittent fasting? They're talking about insulin-like growth factor? I'm going to guess they're talking about intermittent fasting. Joni, clarify your question with IF. Are you talking about intermittent fasting? If that's the, okay, she is. So the question is, will intermittent fasting fix this? The short answer is yes. So studies have shown even short, like a week of dramatically diminished nutrient intake can correct a lot of these problems, assuming that it's not so long-standing, right, that you don't already have cirrhosis of the liver. But yes, intermittent fasting, time-restricted eating, minimizing the nutrition intake does correct these problems. That's why a lot of people that get on a really good diet with the appropriate amount of energy that they actually need to function in this life end up being able to get off of diabetic medications oftentimes. Now, which type of intermittent fasting? You know, some people go with the 2 days of fasting, 5 days of eating. Some people go with every other. Some people go with a week on, 4 weeks of eating. It's all over the map. There's really no clear answer to what's best. I personally believe in time-restricted eating because I try to match it to the circadian rhythm. And to me, intermittent fasting blows The gut clock can no longer match the sun by definition, right? So I'm a big fan of time-restricted eating. But yeah, the answer to your question is all of this starts with overnutrition and inflammation. You're overloading the mitochondria, so more free radicals and reactive oxygen species are made, which is the byproduct of metabolism. So the only way to really correct it is to not provide overnutrition. So yeah, intermittent fasting is a great answer. Obviously, you want to talk to your physician and maybe get that directed and monitored, because there's certain nutrients you need to make sure you're getting enough B vitamins, for instance, D3, things like that. I did not. Was that a question? Something, okay. You don't want to intermittent fast with processed foods. Yes. So ideally, you would be doing time-restricted eating with a very healthy diet, like the Mediterranean diet is my favorite. However, and this is not, I'm not recommending this, but studies have shown just controlling when you eat, even if you're eating bad food, is still healthier than not controlling when you eat. So the timing of the food is super, super important for metabolic health, even if you're eating crappy ultra-processed foods. But if you really want to be healthy and you really want to have functioning joints and no pain, you need to get on a good schedule with a good diet. That is your perfect situation. So when you start to break down the mitochondria in the liver because they're working so hard, because you're dumping all of this nutrition from the gut directly to the liver through that very strong blood connection they have, the mitochondria start to fall apart. You're producing more of the byproducts or the exhaust of the engine. You're making more reactive oxygen species and free radicals. And then, of course, you're going to get more oxidative stress. Malondialdehyde is a urine test that shows that you've got increased breakdown of the cell membranes or fatty acid oxidation. That's a marker of oxidative stress. And then you're going to not process your fatty acids properly in terms of energy. Okay, so that's reduced fatty acid oxidation. And this is associated with some carnitine insufficiency. So that's one of the ways you can kind of help your liver out is with Alcar or carnitine supplementation, because it's responsible for the transport and assists with the oxidation of your long chain fatty acids, your PUFAs, in the mitochondria. So when you have less carnitine, it is associated with more insulin resistance. So this is one supplement that can sometimes help your liver health. And also they've shown that carnitine supplementation actually improved clinical status, meaning the symptoms associated with knee arthritis. So I'm going to tell you different things you can do to help your liver health, but really, ultimately, you just need to eat healthy and not too much. And you want to eat a lot of fiber to prevent that leaky gut, which then just sends toxins directly to the liver. So you're going to have less of this malondialdehyde, which is the oxidative stress marker in the urine. You'll have reduced total cholesterol, reduced LDL when you get healthier, when your liver gets healthier, okay? And carnitine can help with that.
So to clarify, you can test that.
Yeah, I don't think it's a common test. It's probably what we call a send-out test, meaning there's probably only a couple labs in the country that do it or are allowed to do it under the current regulatory environment. But yeah, that is a urine test. Okay, so again, back to mitochondrial health. You have more superoxide, which is just one of the free radical or oxygen species that then attacks fatty acids in your cell membrane and destroys them. It also destroys DNA and protein. You get more of this when you're in an overnutrition state or hypernutrition or hyperalimentation state. Too much fuel overloads the engine in the cell. It can't process it. It spits out all these byproducts. And then everything just goes awry when you run out of storage depot place. So when you run out of storage in your house, you know, everything starts to get cluttered and messed up. Same thing happens to your body. There's only so much fat you can store as white adipose tissue on the outside of your body. Then your body has to find other places to put it. That's when things really start to go downhill. So excess glucose and lipid states, that's when you get more of these superoxide radicals, because again, the mitochondria is dysfunctional. There's too much inflammation. It's processing too much fuel and you're spitting out too much exhaust. So basically, you're going to run through all of your innate ability to detoxify this oxidative stress, or all of your natural antioxidants like superoxide dismutase. That is an enzyme that you make that helps process the superoxide radical. Well, you just blow through that and destroy it all when you have too much, and then you start to get more oxidative stress. So one of the reasons I take a lot of antioxidants is to try to mitigate this problem. And then you have less fuel production, ATP, and your mitochondria basically just fall apart and die. But they can't get repaired and fixed because you don't have the ability to do that because you're insulin resistant and your liver is not able to spit out the proper proteins. So when your liver starts to fail, when you start to get fibrotic tissue inside of the liver, scarring in addition to all of that fat, at the same time, you're going to start getting tissue fibrosis in your fascia. For instance, your plantar fascia, your rotator cuff's going to get stiff and dysfunctional. All your joints are going to get very stiff. You're going to find that you can't touch your toes anymore. You're going to find that you have to physically lift your leg to cross your leg over the other leg because you just don't have the ability to do it yourself. All of this from stiff connective tissues, which we talked about. One of the reasons, the deposits of the advanced glycation end products, and the other reason, the lack of self-repair capacity. And then because you're unable to repair itself because of the low-grade inflammation and the low-grade oxidative stress, your joints are going to deteriorate. It's almost inevitable. So you don't want to get insulin resistant and destroy the extracellular matrix of all of your connective tissue. That's sort of the goo that the cells kind of float in inside of the fascia and the cartilage and the bone and the muscle. Each different type of tissue has a different type of extracellular matrix. All of this is going to start before an X-ray is even close to seeing it. Now, I will say that in some academic centers, they're starting to do these very specialized imaging studies that look for the biomarkers to see these problems sooner. But obviously, that's not going to be covered in a normal insurance plan. This for research only. We really just go on X-rays in the community setting of orthopedics. But all of this stuff is happening before I'm ever going to see a change on X-ray. So I look at things like patients' lipid panels, their hormone panels. I look at their fasting insulin. I look at their fasting glucose. I look at their A1C. I look at anything I can which shows me indirectly how insulin resistant they are, which could explain aches and pains that really are defying any biomedical explanation, okay? Every joint in your body will get thicker because they just get dysfunctional. So dysfunctional tissue is one of the ways the body makes up for a lack of strength and pliability is to make it thicker. So you'll get thicker synovial linings, you'll get thicker tendons, things like that. And then even things like the fat pad inside of your knee behind the patella, the patellar tendon, which allows you to kick a ball. There's a fat pad right behind that inside the knee joint, and that's being seen nowadays as one of the sites of inflammation inside of the knee joint, where you get profibrotic or scarring in that fat pad, and then those fat cells start spitting out adipokines or pro-inflammatory cytokines. So one of the things I do sometimes now is if I have a patient that I have to handle some very acute pain associated with increased synovial inflammation in the knee, I'll try to put lidocaine or Toradol or something in that fat pad to try to reduce the inflammation right at the site of production. So we're starting to learn more and more, but fundamentally at the end of the day, you got to get your insulin resistance under control and get your liver as healthy as you can if you want your body to feel good. Okay, so how do you help your liver out? How do we get more IGF-1? How do we get better hormone production? How do we get better thyroid production, D3 production, et cetera? Is you're going to have to feed the gut or get good insoluble fiber to get those short chain fatty acids and keep yourself from getting leaky gut. You don't want toxins going directly to the liver, and you don't want to eat too much. So you want to eat proper high fiber foods. You don't want to eat too much food because then you're in that overnutrition state that we talked about. And then you want to give your liver all the cofactors and help that you can so that it can process all these things. And omega-3s, that picture of salmon is to show you omega-3 is very important. So how do you know if your liver is kaplooey? Let's just go over some basic liver testing. Hepatologists like to say liver enzymes. The old school thing is liver function testing or LFTs. The main things we look at, the liver enzymes that we really look at is AST and ALT. So that's your aspartate transaminase and alanine transaminase. Anytime you see ACE, that means it's an enzyme. So a protein that is affecting change of a molecule. So it'll change one molecule to another. That's what enzymes do. So AST and ALT are super important liver enzymes that dramatically affect metabolic functions. Bilirubin is responsible for the conjugation and elimination of certain toxins, and it's made from red blood cell breakdown. And then albumin is a marker that shows if your liver is healthy in terms of protein production. So if you have really bad liver disease, you're not making proteins in general like you should be, and albumin is one of the markers of that. So like when we are planning things like total joint replacements, one of the numbers we look at, or when I treat a lot of diabetic foot wounds, if somebody has low albumin, then I know they're going to have a lot of trouble healing things because it's a marker of generalized protein depletion, which of course means your immune cells are depleted, right? So when we check the albumin, that's what we're really looking at, is how good is your liver, how healthy is your nutritional status. Alk phos. Now, alk phos is found throughout the body, but alkaline phosphatase is particularly important in the liver in terms of bile function and looking for things like bile duct blockages. The INR, this is the international normalized ratio. Basically, this just shows how quickly your blood is able to form a clot. Again, remember I told you the liver is heavily involved in coagulopathies because it's very involved in the protein production of clotting factors. And then platelets, which are the white cells that are responsible for healing, giving growth factors to different tissues, but also for forming initial clots. So we look at the AST and ALT, those are your liver enzymes that are important, in the alk phos, those are your super basic livers, and then albumin and your platelet levels. Other liver tests are a little bit more specific, would be like your factor V levels, again, a coagulation factor. There's something called the 13C methionine breath test. I've never done it, but that's a way to look at the current mitochondrial ability of your liver. There's another test called a caffeine clearance test, where you drink like a big cup of Starbucks or something equivalent to that. And then you measure the half-life of caffeine in the blood because the liver processes it. And then back in the 60s, there was a very famous hepatologist, Dr. Sherlock, who would give people ammonia. And if they did not become comatose, that meant their liver was healthy because it could process a toxin quick enough. Obviously, we don't do that anymore. But this is how important the liver is in managing the toxic load that is dumped on us every day in this country, including the toxic load from ultra-processed foods. I don't do any of these liver tests, by the way. I'll just look at the AST, the ALT, check the ratio. You want certain ratios, and that's assuming you don't have sky-high numbers. Once you start getting sky-high numbers, these ratios are irrelevant. But basically, if you've 2-to-1 AST to ALT, you're starting to look at NAFLD and alcohol-induced liver problems. So we'll measure these numbers, make sure they're within range of what's considered normal or optimal, and then we look at the ratios. The GGT is another one, but that is up with anything that causes problems in the liver, so it doesn't really tell you what's going on, and you probably already know that something's going on in the liver because you've checked the AST and the ALT. So the GGT is another test people do, but it's very nonspecific.
Super informative. Thank you so much.
Oh, thank you. Somebody just said thanks for the seminars. You're very welcome. 2 people. All right, so the alkaline phosphatase, and there's actually alk phos formed in the bone too, and there's a bone-specific alk phos you can check. So there are ways to check specific types of alk phos, but generally it's predominant in the liver, and it's formed in the bile canaliculus membrane, so where bile is formed. So when you start having bile obstructive conditions like a gallbladder stone, something like that, your bilirubin is, your alk phos levels are going to go up. And these are the people that tend to start being itchy and stuff because they're not processing bile right. So it's a non-specific test. So if you have somebody with a very high alk phos, let's say their AST, ALT are a little bit high too, and they just have the clinical picture that would make you think a gallbladder stone, that's when you want to do imaging. So like an ultrasound or a CT scan or something like that. So you would want to look for an actual physical obstruction.
Mike has a question.
Okay. Mike has.
The removal of the gallbladder affect the liver health?
Yeah, that's a good question. I don't know exactly. I did not research that too heavily. The question is, how does the removal of the gallbladder affect liver health? Assuming you still have the ability to produce bile, you should still be able to process things appropriately. In other words, if you still have your bile ducts, the gallbladder is sort of like a storage depot for bile, I'm pretty sure. And I think when your gallbladder gets so scarred and inflamed and it's dysfunctional anyway, Nobody gets their gallbladder removed if it's a healthy functioning gallbladder. So by the time you get your gallbladder removed, you've already compensated and you're dealing with effectively no gallbladder as it is. The gallbladder has just become a problem. So as long as you're able to process a bile to conjugate poisons and also to get fat out of the system, out of the gut, you're probably okay. And bilirubin is the breakdown product of hemoglobin. So hemoglobin breaks down to something called biliverdin, which then goes to bilirubin. And then there's direct and indirect. So unconjugated bilirubin is by far the majority of the bilirubin that is in your system. Conjugated bilirubin is less common, but very important, and it's excreted in what's called bile. So as long as you're able to process the breakdown product of hemoglobin into bilirubin, which then becomes bile, your system's still going to work even without the storage capacity of a gallbladder. But the levels of the conjugated bilirubin are going to go up if you're not excreting it, like if it's somehow not making it into the gut.
Real quick before we jump into this, Peggy, she just wanted to say, I know this is not about today's subject, but I want to thank you for my cleaning back with my shoes.
Oh, Stacy, Peggy? Peggy said, thank you for my freedom back with my shoes. I'm assuming you mean the healing soul. And you're welcome. I'm glad. That's the whole point of them, is to help people avoid coming to my office. All right. So how can you improve your liver health besides cutting out excessive glucose and fructose, which is rule number 1? Cut out ultra processed foods. Try to get on a good circadian rhythm. Those are your basics. And eat a lot of fiber. What else can you do? Yeah, sleep is super important. Oh, the Everett. Yeah, awesome. Okay, what natural products can you take that might help your liver detoxify, might help your liver process metabolic things and reduce the inflammation and the oxidative stress that is happening in your liver when you are insulin resistant? So cysteine is one molecule. This upregulates your natural levels of something called glutathione, which is your most abundant antioxidant that we make. It's a sulfur molecule. So if you take cysteine, it's strongly antioxidant in and of itself, but it'll help upregulate your levels of glutathione. So that is a very good way to upregulate one of the types of antioxidant systems inside of the liver cells, and then reduce that damage to the cell membranes and the DNA and the proteins from free radicals. So like when you metabolize alcohol, let's say you went to an LSU tailgate and you happen to have a few too many beers, you're going to have very high levels of oxidative stress in your liver and a lot of inflammation. And cysteine is one way to manage that, okay? Vitamin C is another way. Vitamin C is a very abundant, what we call single molecule antioxidant in the body, and it is able to scavenge free radicals in and of itself, and it'll also help upregulate levels of your own natural ones. Zinc is a very important cofactor for hundreds of enzymatic reactions in your body, especially in the liver, and it's certainly a cofactor for the molecules that metabolize alcohol. We have the ability to metabolize alcohol because some bacteria in your gut, when they ferment fibers, will make alcohol. So, and I think through evolution, humans have been exposed to the molecule of alcohol, so we have a way to metabolize it, and zinc is necessary for that. And then tart cherry extract also helps your liver because it reduces levels of uric acid in the blood, or urate, which are upregulated in the setting of fructose. So when you drink a lot of sodas that have high fructose corn syrup, or you're drinking a lot of juice, you're going to have much more uric acid or hyperuricemia, which then goes on to cause inflammation and problems in the liver cells too. Tart cherry extract is a very strong anti-inflammatory, but also helps out on the uric acid urate side of the equation. So all of these things can help your liver get a little bit healthier. Natural ways to get these things is pigmented fruits. Zinc you can find in things like meats and oysters and stuff. Vitamin C, obviously citrus fruits, but also some green leafy vegetables. And then cysteine, I just supplement with that. Well, I just supplement with all of these, honestly. And rutin. Rutin is another flavonoid, which is a plant-based or phytochemical, a plant-based molecule that is very, very antioxidant. So remember, plants evolved on the same planet with us, and they're faced with oxidative stress and UV rays and stuff all the time. So they've developed natural ways to reduce the levels of the free radicals or the oxygen molecules that are unpaired, or electrons that are unpaired. and we can harness that power. That's why plants are so important for our health. So natural detoxification functions in the liver, again, you have to have enough glutathione. So you want to get your glutathione levels to normal or better, I think. This is your most abundant antioxidant that you make in your system. And it is very depleted when you're detoxifying things. So like, let's say you had a medicine that was particularly bad for your liver and you had to detoxify it. All your glutathione is just going to be totally used up, as will be the vitamin C and stuff. So you need to replenish and replace that, thus the cysteine. Some people will get IV therapy using glutathione. They'll get a direct load into their bloodstream, which is another great option. I prefer oral supplementation, but you can go either way. Carnosine will balance the levels of what's called NRF2, and this is a very anti-inflammatory and antioxidant signal to the nucleus or to the genetic code, tells it to turn on anti-inflammatory proteins and things like that. And so carnosine will help lower the inflammation that is naturally produced through the metabolism of alcohol. NAC, N-acetylcysteine, very well known for its help with Tylenol toxicity. So people that overdose on Tylenol destroy their liver effectively short term, and NAC is one way to reverse that acetaminophen toxicity. And it'll also increase levels of your innate or your the antioxidants you make yourself. So N-acetylcysteine, and that word cysteine, remember before I said cysteine helps. So again, these are sulfur-based molecules that ultimately end up becoming or upregulating glutathione. Very important. Milk thistle is a well-known plant for years, thousands of years. People have been using milk thistle to help with liver health. And that's because, again, it's protecting the liver's glutathione levels through this molecule called silymarin. Now, one of the other functions of detoxification will involve what's called chelation. That's when you just attach a molecule to a toxic molecule and just try to excrete it without changing the molecule or metabolizing it or breaking it down. You're just trying to get it out. Cilantro and charcoal are great for that. So cilantro is a very natural chelator, believe it or not. Some people like cilantro, some people hate it. I love cilantro. Hopefully you do too, because it's very, very good for your liver health. And then charcoal, of course. Back in the day, Navy corpsmen used to give soldiers that came back after shore leave charcoal to try to detoxify the system to get all the alcohol out of them, for example. Spirulina is an algae product, I'm pretty sure. This is a lipid management molecule. Remember, a crappy liver means crappy lipid management because you're not metabolizing anything correctly. So you have more triglycerides, more free fatty acids, etc. Spirulina can assist with that functionality of the liver. Beetroot has actually been shown to help with your bile production, and that also facilitates a natural detox. Bile will conjugate or unconjugate certain molecules. Conjugation just means attaching something to it, changing a little bit, and helping it get excreted. And then dandelion, another famous plant that helps with liver health, has been used in traditional medicine for, again, hundreds to thousands of years. All of these different little molecules can help your liver out. But again, the first thing you want to do is sleep regularly, eat on a regular schedule, eat a lot of fiber, limit fructose, and limit excessive glucose. Now, some people like to take glucosamine to help with their joint health. This is actually the most widely used arthritis medicine out there, particularly for postmenopausal women. But some studies have shown that glucosamine will actually increase your risk of insulin resistance, which I think is probably not something that you want to have happen. So keep that in mind. It may not be the best option to help with the joint pain that you're feeling. That may be a signal of poor liver health. D3. So let's say you have NAFLD, fatty liver. Let's say you're insulin resistant and you have low D levels. Well, obviously, one of the best ways to help that out is to take D3. So I think supplementing with D3 is probably one of the easiest, simplest things somebody can do for themselves. It'll help your bone health, it'll help pain, and it really just helps everything. People that have chronic liver disease or NAFLD are recommended to be on D3 continuously. So no cycle dosing, and don't just supplement whenever you think that you're low. Just assume that you're going to be low in D3 because you're unable to convert to that active form. D3 is the active form. So you want to take that. So again, remember, there are D3 receptors throughout the body everywhere. And when D3 hits a receptor, that goes into the nucleus and alters how the genes function in that cell. So if you're not getting the appropriate levels of D3, almost every cell system in your body is not going to work right. And again, there's a metabolic step that happens in the liver that allows the conversion of the store transport form of D3 to become activated where it's useful. Vitamin K, also a liver produced protein, very, very important for bone health, but also important to protect you from atherosclerosis. So vitamin K will help levels of what's called osteocalcin, which is important for the strength of your bone. It changes how the extracellular matrix is made. So it makes it more organized and stronger in terms of how it responds to the force vectors. So without the appropriate matrix proteins and the appropriate levels of osteocalcin, you may be forming bone, but you're forming weak bone. So vitamin K is very, very important to also take and remember when you're supplementing with D3. There are some foods that you can get vitamin K from, like natto and some aged cheeses, but some people can't get enough from diet or don't like those types of foods. So supplementing with vitamin K is very helpful. While vitamin K helps your bones become stronger and the matrix get organized properly and helps the calcium deposit there in the right way, it actually prevents the calcium deposition that you see with atherosclerotic plaquing. So it's actually great for cardiovascular health too. So it has two divergent functions on calcium metabolism in the body that both benefit you. And again, if you have a bad liver, you're not going to have enough of this.
K1 and K2 or just one of them?
I do the question is K1 or K2. So I do MK4 and MK7, which I believe go to K2, right? Yeah, that's hard to remember, right? MK4, MK7, one is functional for the atherosclerosis, one is functional for the bone. So for instance, the supplement that we have or carry has a good ratio of MK4 to MK7 and it's K2.
Somebody's asking about, I forgot how to say it, liposomol, like that carrier on the thing. You know what I'm trying to say?
Liposomal.
Yeah,
Yeah, different. Somebody's asking about liposomal carriers. There's also nanoparticles and nanocarriers. There's different ways to introduce a supplement to your system to upregulate bioabsorption or release in the gut. I think that's all the liposomals, if that's what this person's asking about. I think that's all that means. Better than oral vitamins, like they're injecting it?
Yeah, I don't think they quite understand what it is. Carry around the vitamin to get the substance.
The question is, are certain carriers of supplements better than others? Honestly, nobody's done those studies, to tell you the truth. The best way to get all of this is a good diet. Let's be real. But in America, it's super hard to eat a perfect, great diet. That's why I supplement all the time. But some drugs have different carrier molecules that allow them to elute more slowly over time or cycle, like pharmaceuticals. For instance, GLP-1 or Ozempic, the way they manufacture that is the GLP-1 hormone is eluted at a steady state over a week, whereas your body makes it and it disappears almost instantly upon sensing nutrition. So that is not a natural way to get GLP-1, but it works really well for the conditions it's trying to treat. Is a liposomal carrier better? I don't know. Is it a fat soluble vitamin or not a fat soluble vitamin? There's a lot of variables that go into that. I guess I could look into that, maybe do a talk about that kind of stuff at some point. But back to gut health and liver health and insulin resistance. Another great supplement you can take is berberine. So berberine functions pretty much the same way metformin does. It'll upregulate this enzyme in your cells called AMPK that is an energy sensing protein. And then that helps to balance the production of free radicals that come out of the mitochondria because it helps to balance how you process sugars into ATP. And so on top of that, it also helps the gut biome function a little bit better so that you have less of that leaky gut and the toxins going straight to the liver. And you're going to produce more short chain fatty acids because more of the insoluble fiber will actually make it to the large intestine. And then this will actually, it's been shown to help upregulate testosterone levels. Remember I told you one of the signs of a bad liver is low testosterone levels or weak estrogen. So that's one way hypogonadism can affect you, but some people have the opposite problem. They have too much testosterone. And these are people with polycystic ovarian syndrome or PCOS, which is highly associated with insulin resistant and then liver problems that are associated like fatty liver. And they have way too much testosterone because the balance is off. So berberine's been shown to help with that. And then to regulate cholesterol synthesis. Again, the liver is responsible for the metabolism of cholesterol, which is a precursor for steroid hormones. So berberine can help regulate blood glucose levels and try to keep you in that tight range that we talked about that you need, upregulate the AMPK activity, which has been associated with increased longevity, and then help to regulate cholesterol and steroid levels.
Berberine also lowers blood pressure, but too much for me.
Berberine also lowers blood pressure, somebody said. So that's an interesting comment because a lot of people used to think that blood pressure is mostly just associated with salt. Turns out it's much more sensitive to sugar levels. So if you're insulin resistant and hyperglycemic, those people have high blood pressure. So yeah, berberine can help with that, yes. All right, we talked briefly about parathyroid hormone. I'm just mentioning this. A lot of people with the osteodystrophy, hepatic osteodystrophy, or if you're so far along in liver disease that you're getting osteoporotic and having fractures, you're going to have to jump up. You're still going to need to take D3 and calcium because none of these drugs work without it, and probably K, but you're going to need to be on a parathyroid hormone analog, one of which is Forteo. There's also Tymlos and Natpara. So I have a lot of patients on these kind of medications that have osteoporosis, and these have been actually shown to help deposit bone, which is great. But the best thing for your bone health is resistance exercise, lifting weights. So again, your gut health is mandatory if you want good liver health because of the direct connection between the blood flow straight from the gut to the liver. So the best thing to do for this is just fiber. Get as much fiber as you can. One of the better fiber supplements is psyllium husk because it has both insoluble and soluble fiber. A lot of the fiber supplements like inulin is just insoluble fiber. You really want, soluble fiber. You really want the insoluble fibers too. The problem I've had with psyllium husk is when you add it to stuff, it makes it quite gelatinous, like when I put it in oatmeal or whatever to add more fiber to make the fiber ratio better versus carbs. It'll kind of turn it into this like gel texture, which is not that pleasant. So you can't put too much psyllium husk. So really the key here is to eat a lot of things like celery, lettuce, green leafy vegetables, stuff that have insoluble fiber themselves. So you can feed the large intestine gut, feed the gut biome and produce those short chain fatty acids and the breakdown products that help your gut and keep it from becoming leaky. Probiotics, a lot of people ask me about this. I'm a big fan of prebiotics, meaning eat enough fiber and you don't need the probiotics because you're going to have a healthy gut biome that way. So that's why the Mediterranean diet's so great because it promotes 9 servings of fruits, whole fruits and vegetables every day, which means you're getting a lot of fiber. So as long as you're eating enough fiber, your gut is going to be healthy, I think. But if you're unable to do that, a probiotic basically is just trying to repopulate the bacteria in your gut with decent bacteria. So it could help, but really just getting your circadian rhythm right and making sure you have some fiber when you are feeding is probably the easiest, safest, most reliable way to improve your gut health. We have a question from Deb. Deb.
She would like to know, is turmeric okay on the liver and kidneys for inflammation?
Is turmeric okay on the liver and kidneys for inflammation? Yes. Turmeric is very naturally anti-inflammatory and antioxidant. There are reports in the literature of people that are on warfarin, which changes how your liver will make coagulation proteins. It uses one of the same cytochromes that turmeric does. So if you're on warfarin, you should probably not be on turmeric because it'll make your blood too thin. But in general, turmeric is great for gut health and great for anti-inflammatory. I put a lot of people on turmeric that have joint pain for that reason. Denise has a question.
I'd like to know, what is your opinion on PRP injections for helping heal the knees with the way?
Okay. A little bit off subject question, but a good one. Denise wants to know, what is my opinion on PRP to help treat cartilage problems in people with knee arthritis? I love PRP. We do a lot of it in my clinic. You know, you're supposed to do it same day, person to person, obviously. So you draw blood from one person, process it that day, and put it back in that person same day. And then you're satisfying regulatory criteria. But PRP is a great way to help the cartilage because you're dropping concentrated platelets into the joint, which slowly will elute growth factors and healing cytokines. So this has nothing to do with, there's no stem cells or anything like that. You're really just harnessing your body's innate capacity to heal and concentrating it and dropping it directly into the body part that you want to heal. You're just giving the cartilage a chance. But again, if you have low platelets, if you have dysfunctional platelets, or if you're not going to change anything in terms of the overall inflammatory load and oxidative stress load, it's less effective. But if you can do the lifestyle changes and then do PRP on top of that, that's been very successful. I do a lot of times, we'll do hyaluronic acid injections, a series of that, and then follow with PRP for people. We've used PRP for rotator cuffs, anything, connective tissue, because you're just dropping in these growth factors and healing cytokines that assist. So yeah, I think it's a great adjunct therapy, but better would be to get your insulin resistance under control.
You have that question that we get, what's your top supplements? Do you want to wait?
Yeah. All right, next slide.
If you don't sleep on a schedule, the gut bacteria die, even if you eat a lot of fiber and probiotics.
Can you go to the next slide? Thank you. All right. So again, if you are so far gone that you're osteoporotic, these are medications that are out there for you. Bone health is very, very important, and it's often missed. I see people all the time where they didn't get their DEXA scan, they've got low vitamin D, we wonder why they're getting stress fractures, why they have all that subchondral insufficiency we talked about at the beginning of the talk, where that signal change on MRI that correlates with pain. So the most widely used medication worldwide is going to be your bisphosphonates. This is like your Fosamax. And the whole goal of that is to get back that coupled behavior between the osteoblast and the osteoclast. You can also do selective estrogen receptor modifiers, because estrogen is extremely important for bone health. And particularly postmenopausal women, as you make less estrogen, that's when most times osteoporosis will happen. So raloxifene is an example of that. And actually, some of these drugs like raloxifene are actually used to help modify the symptoms of menopause, like hot flashes and stuff. And then you've got things that manage your rank L. We talked about how the liver upregulates rank L, which upregulates the osteoclast, which diminishes bone strength. And so Prolia is one of the drugs that handles that stops the osteoclastic formation from being so aggressive. So if you're so far gone in your osteoporosis with NAFLD and NASH that you have osteoporosis, you will have to be on something like this. These are prescription meds for bone health, but none of these work without D3 and calcium on board as well.
I'll just preface Sandra's question. What are the top supplements that you recommend?
Sandra's asking, what are the top supplements that I recommend? I'm going to assume as it pertains to liver health, D3, K we talked about, and then omega-3s, because omega-3s make everything less inflamed in your body. So super, super important. We actually have a liver complex that I formulated that is just a 2-week little thing you take periodically, maybe twice a year, maybe 3 times a year. And it has all of those things we talked about to help upregulate some of the physiologic functions of the liver, at least per the basic science studies. And a lot of the work's preclinical, meaning animal studies, but there are some decent human studies out there. So each one of these ingredients has been studied separately to promote better liver physiology. But of course, no supplement can diagnose, treat, or manage a disease, as you know. But I take a bunch of supplements to help my basic cellular health. And so this one has glutathione, carnosine, it's got the beetroot we talked about, the spirulina, the NAC, the rutin along with dandelion. It does have some psyllium husk to help with the gut biome. Not a ton, but it's some. milk thistle, cilantro, remember that chelates or detoxifies that way, and then other different plant-based phytochemicals to upregulate the antioxidant systems, and then charcoal, which also chelates. Oh yeah, and this is all with well theory, which is the line of natural medicine or empowering substances to help you take control of your own health. So we have a number of products. This is on our liver series, which is to help liver health, because as you can see, it's very important to how people feel on a day-to-day basis and function and perform, which as an orthopedic surgeon, that's what I'm concerned about. I want people to be or have as little pain as possible, be flexible, be strong, and be able to do stuff that they want to do, even when you're getting into 90, 100 years old. So I don't want sarcopenia. I don't want osteoporosis. I don't want cognitive decline. And we can help mitigate the risk of all of that with these kind of supplements, along with lifestyle modification, as we've discussed. And yeah, one of my goals, particularly for my patients, is to help them avoid surgery. This is another formula that I came up with to really help manage alcohol metabolism. Obviously, we don't want you drinking a lot, but alcohol's been around since humans have been around. It's part of life. Sometimes you might have a glass of wine, you might have some beer, again, at a tailgate or whatever. So this I formulated to help you maximize your ability to metabolize alcohol as well as possible. So it's got chromium chloride, which helps with some of that insulin resistance and sugar management. Cysteine, as we talked about, it's got NMN, which is NAD, converts to NAD plus in your body, which again is that electron transporter. To metabolize alcohol, just like when you're metabolizing fructose or high fructose corn syrup, you dramatically deplete levels of NAD plus very quickly. So you do need to supplement that back just to metabolize that properly. Tart cherry extract, which diminishes the hyperuricemia and is also antioxidant. And then the B vitamins, very, very important. When I was a resident back in the day at Charity Hospital in New Orleans, we used to hang what are called banana bags for people going into alcohol withdrawals. And in that was thiamine, B1, super important for alcohol metabolism. And then, of course, vitamin C and zinc. So, you're going to have all this stuff with your normal supplement routine or your normal diet. The problem is if you're going to drink a big load of high fructose corn syrup, agave, or alcohol, you're going to deplete all of it very, very quickly. So personally, I think if you're going to have a glass of wine or beer, or you're going to go out for the night, or it's a Christmas party, those are coming up now, Thanksgiving, you may want to consider helping your liver metabolize it and just giving back what's being used to metabolize it. Yeah, does anybody have any more questions? Otherwise, I guess we'll all move on with our day. So here's what we've talked about berberine, we talked about turmeric, that was a great question, thank you. We talked about NMN, which goes to NAD. We talked about tart cherry. The connective tissue daily has D3, calcium, and magnesium in it. And then we talked about vitamin K. All of these things are going to help your liver, particularly if you have fatty liver or insulin resistance in your liver. And again, we talked about how you can check for that. Your AST, your ALT, potentially your bilirubin or alk phos levels. And then I would check a fasting insulin along with your fasting glucose. So if there are no more questions, those were great questions today, so thank you for those. If you have anybody in your life that you think might want to learn a little bit more about their liver or how it affects their musculoskeletal health, go ahead and let them know. This will be on all our websites, so the welltheory.com, Warner Orthopedics, and then the Facebook pages. So it is available to watch later. We have one question.
Is that magnesium?
I think maybe, yeah.
They just said how much energy is needed on a daily basis.
Somebody's asking how much magnesium is needed on a daily basis. Our formulation has, I want to say, 300 of the salt. That's a hard question to answer. If If you have trouble sleeping, you need a little bit more. If you have neuropathy, you need a little bit more. Most people are mag deficient. 60% of Americans are magnesium deficient. And then the salt you take changes the number of milligrams because you can never absorb elemental magnesium. It has to be attached to a salt to be digestible. So you've got your magnesium gluconate, your magnesium threonate, your mag ox. Yeah, so the 300 I told you about is mag ox. That's what we have, because that allows us to get it to you in an inexpensive manner. But not all of that's going to be absorbed, so it ends up being about 180 milligrams of elemental. Now, you may say, can you check your magnesium levels? You could, but most magnesium is stored in tissue, so the serum levels are not that accurate. But when they've done, research level studies looking at tissue levels, we know that most people are mag deficient. One of the best results I've seen with our connective tissue multi, just putting people on that, is things like restless leg, and that like burning pain in the leg at night kind of goes away for a lot of people because that's all related to magnesium levels. Keeping your minerals and your electrolytes in a very tight range, like we talked about, is important. And most of the American diet, which is ultra processed. Remember, ultra processed, they take everything good out of a pot of food and then mix it with fat and sugar and create a new food that didn't exist on the planet before and put it in a plastic bag and sell it to you. So they're very nutrient deficient. That's why you see breakfast cereal fortified with vitamins and minerals. Breakfast cereal is one of the worst ultra processed foods, I think, that you could eat. So most of us are mag deficient. Most of us are D3 deficient. A lot of us are B deficient, subclinical deficiency for sure, zinc deficient, et cetera. So I don't know how to answer that question because there's no good test for how mag deficient you really are. But in general, about 180 milligrams a day is probably sufficient, elemental. All right, well, hopefully that kind of brought it all together and brought it home for you. The takeaways I want you to remember, besides how you could supplement for it, obviously, is get on a good sleep-wake cycle and try to match your feeding-fasting cycle to it and let your body repair itself at night. It does it on its own if you give it a chance. But if you're not letting your body have a chance to repair your joints and your tendons, and your ligaments, and build muscle and build strong bone, then yes, of course you're going to feel stiff and have pain and creaky joints and aches and pains. So I'm just hopefully giving you some tools to take care of yourself without ending up, in my office needing surgery, God forbid. And happy Thanksgiving to everyone.